Welcome back. Let's go ahead and rejoin anchor Wendy Ryan, who's live at the VA hospital in Pasco County tonight on our special coverage of the mental health crisis impacting local veterans and the new services that are now available. Wendy?
Yeah, thank you, Paul. Joining us tonight is David Dunning, who is the executive director of the James A. Haley Veterans Hospital and Clinics. David, thank you so much for being here. I understand you are not just a veteran, but you're also a VA patient, so you use
Correct.
the VA
Yes.
services in clinic. Tell me how the experience has improved and changed as a veteran using the VA services compared to so many years ago.
Well, thanks, Wendy, first of all, for having us on and highlighting veteran services, and especially the mental health services that we continue to offer and have gotten really much better at in the last decade or so. I think I have a unique perspective that I bring because 30 years in the Army, 2 combat tours, once in Desert Storm, once in Operation Iraqi Freedom in Baghdad. And so I know what they've gone through. I know what's happening. I've had some of the same things too as I struggled to get through what I saw. But I think one of the things the VA helps us do with this is it helps us go from suffering from it to living with it. And that's kind of what we're doing. And so it's really great. I mean, one of the things I don't know if you highlighted was the integration of mental health and primary care. So as soon as the primary care provider sees there's a need, there's a mental health provider right there. And you covered some of the other service. I mean, this great consolidated mental health clinic, we're going to have a PTSD domiciliary where 30 beds, veterans get to come there. They do go through an intensive program to where they deal with PTSD, and it's just one step. It's a continuing process. And then also it's got a 30-bed domiciliary for substance abuse, which is really a big deal because all these things, there's not just really one thing usually when a veteran is suffering. It's usually jobs. Okay, it's homelessness, it's substance abuse, it's all those kind of relationships. And so with a consolidated, we try to do all of that together and not just symptom, we try to go deep in.
Right, right. And I understand that this is the 50th anniversary
It is.
of the VA, August 2022, here we are. So anything else that you can sort of look through all these years, especially as a veteran, that maybe it has improved for you personally as you come as a patient?
Right. I mean, just here, we have one of the world internationally renowned polytrauma centers here where we take care of people with TBI. But not just veterans, we also are partnering with active duty soldiers. We bring them here and work with them through our peak and our prep programs, which help us get them better and sometimes return them right back into the force where we reset. And so it's a really unique place, and we have the largest polytrauma center in the VA.
All right, David, thank you so much for joining us. Good luck on this opening. I understand it's winter of this year, and you have so much more expansion going on. It's a lot of opportunity for veterans to get the help they need.
And I hope everybody joins us for the baseball game that we're going to be highlighted in on the 12th of August against the Baltimore Orioles.
All right.
So come on out and see it.
Good to know. Thank
right.
you, David Dunning, for joining us. And again, we have so much more coverage coming up at the top of the hour as we continue our live coverage here about veterans and their mental health. We're going to meet those behind a PTSD program for combat warriors that's truly saving lives. But for now, I'll send it back to you in the studio. Paul?
All right, Wendy, thank you for that coverage. And let's go.